How would you feel if you or one of your relatives had to wait much longer than you really should for a diagnosis of heart failure? Once diagnosed with heart failure, your chance of being around in 5 years is about 50%. I've got just 3 minutes to tell you about how Biohabit and NT-proCheck can revolutionize the diagnosis of heart failure, saving the NHS millions. In Cheshire and Merseyside, where I work, this is one of the hardest hit regions in the whole of the UK for acute heart failure admissions. Patients present in a time of crisis, struggling for breath and struggling for their lives. Unfortunately, about a third of these patients have had a missed opportunity to diagnose heart failure somewhere along the line. This is bad for patient outcomes, but also costs us much more in the NHS system to treat them and to make them better. I can't treat what hasn't been diagnosed. It's vital to make an early diagnosis in heart failure, to allow us to do the right tests and institute the right treatments, so patients don't have to suffer for months and months waiting, and so we can prolong their lives and improve their quality of life. Worryingly, the average time for a patient to have a serum NT-proBNP test from the time that they present can be up to 3 years. That's ridiculous. I just can't accept this anymore. So Biohabit have developed NT-proCheck, a simple point-of-care diagnostic test to rule heart failure in or out. And the kit that you need couldn't be simpler. It's just an oral swab like this, which would be run along the top and bottom gum lines to take a sample of oral fluid, and then it'll be inserted into a cassette to get a typical lateral flow readout, which would be positive or negative. So by implementing NT-proCheck in primary care, we'll be able to strip away many of the layers involved in the complex referral pathway to get a diagnosis of heart failure. This can be done in the GP surgery, in the hospital, or even in the patient's home. What matters is that we get a definitive answer, and we get it quickly. This no-nonsense test could save the NHS up to £125 million per year. So thanks for listening. I really appreciate it. But for now, I've got to get back to my patients.